Hello and welcome to another update regarding current economic affairs on our YouTube channel, Urdu-Hindi Economics. Today we are going to talk about a trade-off, supposed trade-off between health and economy during COVID times. That is to say, whether there is a conflict between health and economy during COVID times. If you are going to safeguard health, then economy will suffer. And if you are going to safeguard economy, then you have to face maybe large-scale death rate because of COVID-19. Now, as COVID-19 spread across different countries across the world, in the beginning it was believed, as came from the experience of China, that we have to go for lockdowns. We have to restrict the movement of people so that we are able to safeguard the lives of the people. We ensure the health of the people. And more strict lockdowns were considered more efficient, better in comparison to mild forms of lockdowns. Obviously, when different economies, different countries went for lockdowns, it was beforehand understood that lockdowns are going to hit economies. Lockdowns are going to hit growth rates, GDP production in the economies, and then employment, state of employment in those economies. So as different economies went for lockdowns of different degrees, some milder, some very strict forms of lockdowns, economies were hit. The production of goods and services got reduced, and then unemployment rate rose significantly, particularly in the middle of the process of lockdown, in the middle of the COVID-19. Now today an issue arises, and it is that because now we are sufficiently into it, we are now having an experience about both GDP and then the deaths related with COVID-19 of different countries. So now the issue arises here is that whether the supposed trade-off between health and economy was a true one or not. Whether it was based, this assumption was realistic that there's a trade-off between health and economy. Now put it differently, we can say were those economies, those countries which went for more strict lockdowns and consequently they sort of deliberately hit their economies strongly, their GDP got reduced strongly, then unemployment rose substantially. Were they able to save more lives in comparison to those economies which in which the policy was that of mild form of lockdown? Or we can alternatively say that whether those economies which went for milder form of lockdowns to safeguard the lives of the people from COVID-19 and focus at the same time on economies as well, on their economies as well, whether these countries faced more deaths because of COVID-19 or they had more death rate because of COVID-19. So this is an important issue that we need to understand after many months of experience with both these things. So we can sum up, we can say that whether there was a trade-off between health and economy as was assumed at the beginning of the emergence and spread of COVID-19. There's an organization, trust you can say, its name is Global Change Data Lab, and it is a registered charity in England and Wales, and it has a project which is known as Our World in Data. Our World in Data. Now this think tank has done research, database research on the supposed trade-off between health and economy during COVID times, and obviously it assumes a lot of significance given a general belief that strict lockdowns are far better as compared to milder ones to safeguard the lives of the people. A scholar by the name of Joe Hassel, is a scholar who has written his research, who has given his research on their website, he uses 38 countries, data from 38 countries, for which the data of GDP, obviously we have now data regarding COVID related deaths in different countries. So he uses 38 countries for his research to understand whether there's a trade-off between health and economy during COVID times. Now, our presumption was that if you go for less deaths, then you have to do stricter lockdown, but at the same time the economy will be hit strongly. So we have less deaths, we have more decrease in GDP, and we have more deaths than less decrease in GDP, as was believed in the beginning. But the research that this scholar has done, it shows that if we look at the countries like Peru, we look at countries like Spain and then UK, and you can add countries like India, for example. Now in these countries what we see is that the death rate is more, and there is more decline in GDP of these economies. So not only is the death rate more in these countries, but also GDP has decreased more. And on the other hand, what we see is that Taiwan, South Korea, Lithuania, etc., these are the countries where we have less death rate, and at the same time there is less decrease in the GDP of these economies. So Joe Hassel's research tells us the trade-off, supposed trade-off between economy and health doesn't hold true when we look into data. The database research refutes this very belief that there is a trade-off between health and economy when it comes to COVID-19, when it comes to COVID times. We need to formulate policies in more appropriate ways, and then we need to take into account many other factors while formulating our policies, and being smart with the imposition of lockdown, so on and so forth, that will ensure that there will be not only less number of deaths, but at the same time there will be less impact on the economies. Those countries which have ensured that the death rate is low, the number of people who die in their countries, their number is low, and at the same time their economies have not been hit as strongly, we need to learn from those economies. And the policies that these economies have adopted to ensure that not only is health safeguarded, but also the economies are protected from negative impact that come with strict lockdowns. Thank you very much.